I'm Neil O'Grady, osteopath, and today what I'd like to explain to you is a muscle energy technique for a type 1 lesion in the lumbar spine. That's a group lesion, so a number of segments which, according to Freud's law, would be side bent to one side and rotated to the opposite side in neutral. Okay, so in this case we're looking at a type 1 lesion in the lumbar spine, and we're going to say that it is rotated to the right and rotated to the left and side bent to the right. So we're going to say all the lumbars, so L1 to L5 are all rotated left and side bent right. So Nicola, I'm going to ask you to turn on your side to face me. So in this case what I want is the concavity to be facing toward the couch. So the rotated facets are upwards and the side bent facets are downwards. So what I'd like to do then is I'm just going to monitor the apex of the group dysfunction. So I'll be in around L2, L3. I'm going to flex the patient's hips and knees to 90 degrees. If they're in the middle of the couch, scoop, pull, okay, like that. I'm resting her knees on my thigh here, like that. And all I do here is I'm going to have my hands hooked under the lower foot. I'm going to side bend her this way. So this will side bend the spine, the lumbar spine, in this case to the left, which is away from the concavity, so into the barrier. And I'm going to get you to push your lower foot at about 20% of your full strength toward the floor, so this way, okay? So an isometric contraction for about 5 seconds. 1, 2, 3, 4, 5, relax, breathe in and breathe out. So I'm bringing it up to the next barrier, so I'm side bending the spine. There's the barrier, and push down again. 1, 2, 3, 4, 5, relax, breathe in, breathe out. And typically I do that maybe 3 to 5 times. About 3 times is normal, and eventually then on the last one I'll just do a passive stretch. So breathe in and breathe out. I'll just do one large stretch. Okay, and this is very useful also for correcting or muscle tightness where the spine is rotated to one side and side bent to the other. Also, if you've got somebody who maybe has a disc problem, which is a grumbly disc, we'll say, which is posterior lateral bulge on the right hand side, and by doing this and side bending away, you're taking the pressure off you're opening the facets on that side at that level, and you're taking pressure off the nerve root. So that can be nice as well for that. Or someone maybe has just an increased amount of wear, hypertrophy on the facets on that side. By doing this, you're taking pressure off the facets as well and taking pressure off the nerve roots. Or if it were stenosis, similar kind of thing. Okay, so then I'll return her legs to the couch like that. I'll get you to roll over on your back. And that, everybody, is a muscle energy technique for a type 1 lesion in the lumbar spine. If you like the content and you'd like to subscribe, please hit the subscribe, and in the comments let me know if you want me to make any other videos on anything else. And thank you very much for watching. Talk to you next time.